Catherine, this program is simultaneously on Zoom, YouTube, and Facebook. So the audience will watch on Facebook, somebody will join on YouTube, and some people on this Zoom platform.
Very exciting.
So very happy that the WHO is taking a very active interest and positive attitude in trying to promote brain health and mental health. I think so many programs, IGAP is going on 2022 to 2031, other programs, de-addiction programs, substance.
No, very much so. And for us as a relatively new unit within the World Health Organization, the Brain Health Unit only came into existence in 2020. It's very exciting to have a global action plan and a mandate already so soon after our creation. And this really also signifies the importance that that we're all putting towards this topic. So no, absolutely agree.
Yeah. Dr. Nirmal Surya joined. Nirmal Surya is the president of Indian Academy of Neurology. Good evening, Dr. Surya.
Good evening, Chandrasekhar. Good evening, Catherine, Tamija, and all the panelists for today.
Mansi.
Yes, sir.
Yeah, I think Dr. Gauri Devi has joined, so you can take her in the room. Dr. Gauri Devi is in audience.
I will call her and tell her.
Yes. Now is a panelist. She's
Good evening, Madam Dr. Gauri Devi. Can you hear us?
Yeah, good evening. How are
Good
you?
evening. Good evening.
Really appreciate this fantastic initiative of IAN with WHO. It's really remarkable what you're planned and doing. Congratulations to the whole Executive Council and all the members. Thank you very much.
Thank you, madam. Dr. Nirmal, should we start? We are waiting for Amit actually. Dr. Dhamija, can you connect with Dr. Amit?
I'm just calling him.
Yeah.
He has joined as a audience. Can we bring him to the as a panelist?
Mansi,
yes, sir. Yes, sir. Just
get Dr. Amit in.
Yeah.
Yeah, okay. Now the panel is complete, so we can start.
Dr. Amit, can you hear us? Dr. Amit, this is Dr. Dhamija. Can you hear us?
Yes, good evening.
Welcome.
Good evening. Good evening.
Welcome.
Welcome. Thank you.
Dear friends, good evening and good afternoon. I am Dr. Chandrasekhar Meshram, co-opted trustee of World Federation of Neurology and chief coordinator of public education activities of Indian Academy of Neurology. So on behalf of Indian Academy of Neurology and World Federation of Neurology, I welcome you all for this session on substance abuse and brain health. In the week of World Brain Week celebration, this is the second session. Yesterday, we had a wonderful first day with the evening webinar was fantastic, and throughout the day we could organize 35 to 40, 35 to 40 activities in different cities in the country. So that was quite wonderful. For today's session, we have great experts in the field. I would like to welcome Dr. Catherine Seher. She is a mental health and brain health specialist, Department of Mental Health and Substance Use, World Health Organization, Geneva. Dr. Catherine originally was trained as a psychologist, then has been working with people with neurological disorders like dementia and their families for over 15 years. That's so quite amazing. In her current role as the WHO Brain Health Unit, Catherine is responsible for the implementation of the Global Action Plan on the Public Health Response to Dementia 2017 to 2025 and has been coordinating the development of WHO's position paper on optimizing brain health across the life course. And that position paper will be discussed in the meeting on 9th of August. I would also like to welcome President of Indian Academy of Neurology, Dr. Nirmal Surya, who is a consultant neurologist at Bombay Hospital and a very dynamic and enthusiastic president. And because of his motivation, we are able to do so many activities in the World Brain Week. We have Dr. Rajinder Dhamija, who is a moderator for today's session. Dr. Dhamija is Director, Institute of Human Behavior and Allied Sciences, New Delhi. I would also like to welcome Dr. Prabhat, who is Professor of Psychiatry at the Center for Addiction Medicine and in charge National Institute of Mental Health and Neurosciences, Bangalore, and he's in charge of Niman's Digital Academy. I would also like to welcome Dr. Amit Chakravarti, who is a scientist F and officer in charge of ICMR Center for Aging and Mental Health, Kolkata. And my friend, Dr. Sudhir Bhave, who is consultant psychiatrist at Nagpur and has been very active in organizing the public education activities with me over last 30 years. I take this opportunity to welcome Professor Gauri Devi, who is a very senior neurologist and has been head of the department and director, and she was editor of Annals of Indian Academy of Neurology, and Dr. Gauri Devi was director at Nimas, Bangalore. So welcome, madam. And with this note, I request Dr. Nirmal Surya, President IAN, to give his welcome address. Dr. Nirmal Surya. Dr. Nirmal, please unmute yourself.
Yeah, sorry. Thank you very much, Dr. Meshram, for this honor. And I must welcome Dr. Catherine from WHO. It's indeed is a great pleasure, madam, to be here on the occasion of the World Brain Week, which we have been celebrating. We had, as Meshram has already told you, yesterday we had a wonderful inauguration, and we have planned for more than 100 activities in 1 week, and we are already reaching more than 50% by today. We already had 2 webinars today, and this is the 3rd webinar. I have been actively involved with the Southeast Asia Regional WHO Center, and has met Mrs. Poonam Keterpal regarding One Neurology support from our side. I am also the ambassador for One Neurology at this, and so I know that what effort you have been putting to bring this GAP for the epilepsy and other neurological disorders. So this global action plan is so important, which has been approved in last meeting, and I think next 10 years are going to change the neurological services across the globe. And I heartily welcome you all. And today's topic on addiction, and this is very, very important, because many people are not aware that how the neurology can be affected, and therefore the brain health for all the theme we have chosen every day, one of the theme, and today's theme has been this, and I welcome all other panelists, and I'm sure the people across the country would be hugely benefited by the experience and a suggestion from you. I once again welcome you, and I assure everyone around that Indian Academy of Neurology will do best for the people of this country and around this country to help them learn, educate, and support them wherever it is been required. Thank you very much.
Thank you very much, Dr. Nirmal Surya. To set the things rolling, I now request Dr. Catherine to give her presentation. Dr. Catherine, please.
Thank you very much. I'll just try to get into screen share mode. It's a great pleasure to be here with you. Thank you so much for the invitation. Can I just check that you see the full slide?
Yes.
Not the talking point?
No, I think you have to make full slide, ma'am. It still shows the, you're right up in the right side.
Is that better now?
Yeah,
Perfect.
now it is fine.
Yes, this is good. Okay.
Yeah.
Okay. Thank you very much. And namaste. Greetings from the World Health Organization in Switzerland. Like I said, it's a great pleasure to be here with you. I send the regards from Dr. Torundua, who is the unit head of the Brain Health unit. She's currently traveling on duty in Tanzania and can't join, therefore, herself. But it's great to celebrate World Brain Day with you all. This year's topic, Brain Health for All, is extremely important to us and to our unit. You could even say it is the motto every day and overall of what we do. So very fitting and very pleased to be here. I should say, as a disclaimer up front, I'm not a substance use expert by no means. I leave that to the great panelists that come after me. But I have the great pleasure to tell you a little bit about our brain health program at WHO and how substance use link in there. And I should also give credit to the brilliant team that we have at WHO. First and foremost, Dr. Kavita Kolapa, who's been really instrumental in also developing the position paper that I will show you or talk a little bit about it. So why is brain health so important? There are compelling reasons for overall global action. That's first and foremost, the brain is the most complex organ in the human body. It does amazing things and yet is still one of the greatest mysteries on earth, really. Neurological disorders or affecting the brain are, as you probably know, the leading cause of disability worldwide, and they're the second leading cause of death globally. And it's estimated that about 1 in 3 people will develop a neurological disorder at some point of their life. So it really affects us all. The majority of the burden associated with neurological disorders really are shouldered by low and middle income countries, with 70% of people with neurological disorders living in low and middle income countries. But despite that growing threat or that overall burden, the policy response has really been insufficient globally. And the same is true for access to services or support to promote brain health for everyone. Yet there is a lot that can be done to optimize brain health for everyone. There are a multitude of factors that affect our brain throughout our lives. If we address these factors, we can help the brain or support its ability to grow, build new connections, and recover and even compensate for injuries that we might acquire throughout our lives. Some of the common threats to brain health lie within our genes, but then there are also certain physical health conditions like infections or metabolic risk factors, traumatic brain injuries that really harm our brain. And the same is true for unhealthy behaviors such as tobacco and alcohol use, which I will come back later in my presentation. But also other unhealthy behaviors such as poor nutrition, poor sleep, or lack of physical activity. Also, over the last few decades, we've understood more and more how certain environmental factors, such as air pollution or the use of pesticides, really can seriously harm our brains and are associated with certain neurological conditions. But many of these factors we can address, so brain health can be optimized, but global efforts really are required. And this is where the intersectoral global action plan on epilepsy and other neurological disorders now comes into play, as you've heard. So when the WHO member states earlier in May this year adopted anonymously this 10-year action plan, it really presented that global commitment that we now need to address brain health for all in the most comprehensive way possible. The intersectoral global action plan envisages a world in which brain health is valued and promoted. Neurological disorders are prevented, diagnosed, and treated. And people who live with neurological disorders and their carers can attain the highest possible level of health. The plan has the goal to reduce the stigma, impact, and burden of neurological disorders, while at the same time improving the quality of life of people with neurological disorders, their carers, and their families. And I know these are values that you all very much share and promote in your everyday life. The action plan has 5 strategic objectives with associated recommended actions and global targets. And the 5 strategic areas are prioritization and governance. And this is where initiatives like World Brain Day are so critical in raising awareness and advocacy for the topic overall. Other areas focus on diagnosis, treatment, and care, or promotion and prevention, where we do address those risk factors that I showed you on the earlier slide, and I'll come back to them in a second. Other areas include research, innovation, and information systems, and one specifically dedicated to strengthening country capacity or system capacity for epilepsy. And the idea behind that is that we're using one neurological condition to build country or system capacity for all neurological disorders. So the Intersectoral Global Action Plan is the overall mandate and our 10-year roadmap, if you like. But in parallel, we've developed this technical complement, the Brain Health Position Paper. And that really presents a definition of brain health and then a framework of what brain health optimization across the life should look like. We included a summary of the latest science behind a brain health optimization and make the strong case for optimizing brain health and action across all areas or parts of society. So going well beyond the health system or health sector. So what is brain health? Brain health is a state of brain functioning across multiple domains. It's really, for example, our ability to think, feel, move around, communicate. So everything that allows a person to realize their full potential over the life course, irrespective, and that is important, of the presence or absence of disorders. What do we mean by that? We feel that brain health or brain function can still be improved even in the presence of brain disorder if we're addressing certain determinants. And this is really what the position paper and the action plan are all about. So what does the framework of brain health optimization look like? You have here on the left the brain health determinants. And these are really the risk factors and the protective factors, if you like. They're all interconnected. So even though they look like distinct groups, they're all interconnected and related with each other. And they act at the individual as well as at the societal level. We can roughly group them in these 5 categories, which are physical health factors, healthy environment, safety and security, learning and social connection, as well as access to quality services. Now, if we address these determinants, we will not only reduce the prevalence of neurological disorders and improve the quality of life for people living with neurological disorders, but we will also, with improving brain health, create benefits for overall health for individuals and society, as well as social and economic benefits. And the position paper outlines how this can be achieved or what the mechanisms behind that are. On this slide, you see the brain health determinants, again, with some concrete examples of the risk and protective factors that sit within each cluster. So in the area of physical health, for example, you may have certain physical conditions or infections that cause meningitis or encephalitis, so are harmful to the brain. In the area of healthy environments, you have the exposure to chemicals and pollutants that are harmful for the brain. The position paper also emphasizes the importance of lifelong learning, access to learning opportunities, and social connection. It also highlights the importance of protecting us against physical harm, for example, physical abuse or violence, not just because of the direct effect or the direct harm that violence can have to the brain in the form of injury or damage, but also through indirect or stress-related responses to those experiences. And then there's a whole block or category of access to quality services and care. But because the focus of today's presentation or session really is on substance use, let's now look at some ways at which substance use can impact our brain. First, that's substance use during pregnancy or while breastfeeding. We know that substance use during those critical times are linked to neurodevelopmental disorders in the baby, fetal alcohol syndrome. It's linked to certain types of childhood cancer that grow from the nerves, and has also been associated with poorer cognitive function in children as they then grow up. The second part I want to focus on is tobacco use. So smoking in general has been linked to an increased risk of stroke, dementia, multiple sclerosis, just to name a few of the neurological conditions. And I've included some numbers here for you. For example, smoking is related to 21% of the overall global stroke burden, and secondhand smoke is even is responsible for up to 2% of stroke burden. And if we were all to stop smoking entirely, we could prevent up to 5% of dementia cases. So this is how important smoking is for some of these neurological conditions. And then the last category here on the slide is alcohol and the harmful use of alcohol. We know that this is causing 3 million deaths every year. It's also linked to an increased risk of developing dementia, for example. And that is because alcohol is toxic or can cause direct damage to the brain in the form of shrinking or nerve degeneration. Alcohol can also have indirect effects on the brain through mechanisms such as nutritional deficits in people who are alcohol dependent, or if you go through alcohol withdrawal, complications such as seizures, delirium, or injuries. And then the last part is the alcohol-related violence or abuse that we see, or road traffic injury accidents related to alcohol or drink driving, which in extension can also cause direct damage or injuries to the brain. Importantly, though, there's now also evidence coming out that interventions that improve mother-child interaction or peer relationships, so interventions that target some of these determinants that I showed you on the earlier slide, can really help and prevent, for example, substance use disorders in young people who are exposed to adversity. So what does that mean? So there is almost like a compensating effect that we can have by promoting brain health or addressing brain health determinants, in kind of buffering some of the negative effects that would otherwise then be associated with potential substance use disorders later in life, which is a really good news story. But I also want to leave you with more positive messages to remember from this talk and presentation. While there are no doubt policy actions that are required to address the bigger issues that we're facing, there are some things that each and every one of us can do every day to protect our brains. And the overall message here really is what's good for your heart is also good for your brain. Do not smoke for the sake of your lungs and heart, but also for the sake of your brain. Do not drink alcohol or only in moderation, and definitely do not drink alcohol, smoke or take any drugs while pregnant or while breastfeeding. And other things that we can all do include things like being physically active, eating healthy diets and getting enough sleep. We should all be stimulating our mind and brain as much as we can, and wear a helmet to protect our heads from injury. Because after all, like I said in the beginning, we only have one brain, and it is worth protecting. With that, I hope to see you all again on 9th of August when we're launching officially the Brain Health Position Paper, of which you've now seen a glimpse. The QR code to register for the event is here on this slide. And with that, I thank you very much for your attention, and I wish you a very happy, healthy World Brain Day. Thank you very much.
Thank you, Dr. Catherine, for a wonderful talk. And I must compliment that this position paper on brain health is an extensive and very well written document. And it gives answers to everything, and from birth to the death across the lifespan. It's a very well described and a very detailed document. I had the opportunity to study the paper in details.
You also provided very valuable inputs and feedback, so thank you very much.
So it's very important, and everybody must go through it and promote the paper and learn the things and try to adopt whatever said in the paper, and try to implement and try to improve the brain health, the people, and prevent the neurological diseases. That is the main aim of all this World Brain Day and World Brain Week, that we want to have awareness and prevention of diseases. Dr. Catherine, thank you very much. Maybe that we'll have, if there are questions for you, then we'll ask you. And now I hand over the mic to Dr. Rajendra Dhameja to conduct the further proceedings and the panel discussion on involve all the panelists, and so that after the panel discussion, and we'll have a question answer session from the audience, and we'll take up questions. I am sure there will be a lot of questions, because this topic of substance abuse is such a burning and issue of day-to-day importance. Thank you very much, Dr. Catherine, once again. Dr. Rajendra Dhameja.
Thank you, Dr. Chandrasekhar. Good evening and good day to all of others. And it's a proud privilege and honor to be here amongst this panel. And once again, I must compliment and thank Dr. Chandrasekhar as well as Dr. Nirmal Surya for having a feast of activities on World Brain Day and World Brain Week. So today's session is very, very pertinent and important, because this is aimed to create awareness for the masses in general about the effects of drug abuse and dependence on the brain, and thereby to prevent drug abuse. We also want to help people already into drug abuse to quit the substance abuse, the drugs. For the information of all the panelists and the audience, as per the study published by the All India Institute of Medical Sciences, New Delhi, in 2019, India has nearly 160 million alcohol users, approximately 16 crores, what we call 160 million 160 million alcohol users, of which approximately 30 million are dependent on alcohol. Apart from alcohol, India has nearly 30 million other users of different preparations of cannabis and around 23 million opioid users. So these are huge numbers, and we are looking at glaring loss of productivity in this young population. Not only this, the number of suicides due to drugs and alcohol addiction has more than doubled in last 10 years, as per our National Crime Record Bureau data. In fact, in last 2 years of pandemic, different challenges have come up again for the drug users, for treatment, and for the people who are involved with the de-addiction programs and the providers. So let me begin with just mentioning that the substance abuse or the addiction is just like any other disease involving the nervous system or the other systems of the body, like diabetes, cancer, and heart disease, and it can be caused by a combination of behavioral, social, psychological, environmental, biological factors in combination with sometimes genetic factors as well. And if this addiction is not treated, then the consequences often include physical and mental health disorders that require medical management. So this brings us to the implication of having this addiction as a chronic disease. It doesn't happen overnight. There are many factors which lead to drug and alcohol addiction, including as I mentioned, plethora of risk factors. People are into this because of the experimentation, regular use, high risk use, and finally addiction or dependency. So it is important now to discuss what causes, what are the signs, and how we can identify the early signs of people getting into this disorder, or maybe teenagers. So let me begin with asking Dr. Prabhat, who is Professor of Psychiatry and the Chief of Addiction Medicine at NIMHANS, Bangalore. Dr. Prabhat, how do we know that if somebody is using or is addicted to drugs? And in particularly, I'm more worried about the teenagers. What are the signs that tell us that our teenager son or daughter may be using the substance in our society?
Thank you, sir, and thank you, Indian Association of Neurology and WFN. It's very nice to see, people are talking about brain addiction being brain disease, which is obviously yes, but having neurology forum talking about this is something I think is important. And Dr. Catherine did mention about addiction is developmental disease. It's a pediatrics disease manifested the teenage, what you're mentioning now. So I think Dr. Catherine did mention about how we start before the fetus is born, pre-uterine, and she's mentioned about adversity, stress, how it makes the brain to develop. And you can see some teens develop substance use, some don't develop. And that's why interventions goes beyond intervening the person and start from the lifespan approach. I completely agree with Dr. Catherine's point that that's how we look at. Now coming to the questions, sir, I can tell to the outpatient when I was there, I saw somebody whose parent, very young boy, a very successful, boy who's taking 12th class, as you know, and the parent came to us telling that this boy is using internet gaming around the clock. A very, very bright student, completely, whole day he uses the internet gaming. Somebody scored 95% in the class 10th, is struggling to pass the 12th. So these are the different form of, things. So the way you can identify a young boy probably getting into the substances is scholastic decline on the indication, a decrease in attention and concentration, maybe stealing money if you are taking substances where to procure, maybe spending more time outside, and maybe these are the environmental marker. Other markers, if you are looking at substances like using cannabis, you can find out the smell in the mouth. The conjunctiva looks a little reddish. Mostly mothers identify much better than the father. This is again clinical experience. When a boy comes back, they think, oh, why this? And sometimes you suddenly find in the pockets some green grass like thing, in the cupboards or pockets, may or may not, but you'll get it if carefully mother find out. It takes some time to find out. Then if people are taking injectable drugs, then you can find syringes, most in bathrooms, candle waxes, because you have to boil the heroin to inject it. So a candle and wax or matchsticks So these are again indicators that the young boy started. So these are the hard indicators, but soft indicators are generally scholastic decline, sudden behavioral change, certain mood swings. Those are the major indicator, but often it's difficult for the parents to actually identify it. Sometimes students in school may bring to notice. They must sometimes identify much earlier because adolescent teens spend long time in the school. So we have to take multiple information, and high degree of suspiciousness is something to be important to find out. I mean, this is a more of a history
Thank you.
type of. Yeah, thank you, sir.
Thank you, Dr. Prabhat. I think you very rightly said the mood swings, the physical changes, loss of interest in the activities, poor scholastic performance. These are the indicators of identifying people or the kids or the teenagers getting into this kind of behavioral disorders. So, having said that, now we're coming up to the mental health and substance usage dual diagnosis. So many mental health and substance use may seem to be two different conditions, but exactly in 1 in 4 adults has both substance use as well as the mental health condition both together. That is why we have dual wards and dual OPDs dealing with the mental health issues as well as the drug addicts. So my question to Dr. Amit is, how often do you find that substance use can lead to the brain health disorders or mental health disorders?
Thank you. Thank you, sir, for inviting me in this August gathering. Yes, your observation is perfectly valid. So I remember that we are doing a large epidemiological investigation on alcohol use among coal mine workers. That was a couple of years back on behalf of ICMR, because we know the prevalence of alcohol use in India is close to 20%. And it has been seen that among the mine workers who are so-called work in a high-risk profession, the prevalence of alcohol use is much higher, could be around 50 to 60%. And it's associated with high levels of economic cost, including healthcare cost. And most of these workers with alcohol use disorders, they do not have access to any psychiatric services or mental health services. So we decided to investigate how can we integrate screening for alcohol use disorders at the primary care level and initiate basic management at the primary care level. So when we started screening for these workers with alcohol use problems, we really find that the prevalence of alcohol use problems at different levels of alcohol use, from low risk to moderate risk to high risk or dependent levels of use. Surprisingly, we also screened for anxiety and depressive disorders. And we found that close to 50% of these workers have either an anxiety disorder or a depressive disorder or both. So we can't comment that what comes first. Is alcohol disorder is upon alcohol is upon depressive disorder, or depressive disorder comes first, which results in alcohol use disorder. That's a very interesting connection, but it is absolutely correct. It is spot on that in case of alcohol use disorder, anxiety disorder, or depressive disorders are very common. Similarly, among kids who have substance use disorders, we are very likely to encounter externalizing disorders. Bunch of externalizing symptoms. And in other population-based studies, we also have a neurodevelopmental cohort, one of the largest neurodevelopmental cohorts in India, with a size of 9,500, close to 9,500. And we have found kids who use substances, they are more likely to have externalizing disorders. So this association or dual diagnosis is a very valid observation, and it requires an added dimension to the management that is required for substance use disorders. Thank you, sir.
Thank you, Dr. Amit. So you rightly said that the many of the substance users or for example, opioid users are at a greater risk of experiencing depression, and alcohol use can cause anxiety and antisocial behavior, as you mentioned. So coming to Dr. Sudhir Bhave, what are the different kinds of substances which are used for addiction and other purposes, and can addiction be effectively cured?
Yeah, the kind of substances are very many, and I think it helps if we classify them into some commonly available categories. We start with alcohol, then we have something called cannabinoids. Cannabinoids are the substances that come from a particular plant called cannabis sativa, and this gives us three things. One is bhang, second is ganja, and the third is hashish or charas. Thirdly, we have opioids, which come from another plant called Papaver somniferum or poppy. And from this, we have crude opium. Crude opium can be converted to heroin, which can be converted to pharmacologically available opioids like morphine, pethidine, codeine. Brown sugar, which is fairly commonly known, is a kind of adulterated heroin. Then we have amphetamine-like substances that stimulate the brain. Amphetamine, cocaine, nicotine, they are all brain stimulants. Then we have something called hallucinogens. So as the name indicates, hallucinogens are the substances that lead to hallucinations. That is, a person starts perceiving something, either hears something or sees something that does not exist in the objective reality. I think we all have heard of names like LSD and psilocybin. LSD, I think from the hippies era, it's a well-known drug found in places where there was a lot of hippie culture. Then we have inhalants. Inhalants are not very common, but a rather, I might say, interesting kind of category where people like to inhale drugs like paint removers, cleaners, glue, gasoline or petrol. And once in a while, we do see patients who are working at petrol pumps, and after giving the petrol, I mean, they're the salespeople. After pushing the petrol into someone's vehicle, they put the nozzle to their nose and keep inhaling that, and might end up in withdrawal on a day when the petrol pump is not working. Then we have sedatives, drugs that we commonly use for sedation or anxiety or for inducing sleep. Like we have different categories in sedatives. So these by and large are the different categories. Now with the passing times, more and more varieties are coming to the fore. Like once in a while in the newspapers, we read something about a snake bite being used as an addictive substance, or something that might be labeled as a novel, some painkiller ointment being used as an inhalant. But the categories that I mentioned, they are by and large the ones which are relatively commonly used.
Thank you, Dr. Bhave. Dr. Catton, you very well mentioned about the brain and the substance abuse and the effects on the brain. And you also mentioned about the intersectoral global action plan, which we are also involved with as an ambassador from the European Academy of Neurology, with me and Dr. Nirmal Surya and Dr. Bindu, three of us from India, the ambassadors. And we have been working for this document and the other papers to be published during this. It was supposed to be published during the May assembly, but somehow it is being delayed at the European Academy of Neurology level. But we are lucky to have you as a not only a brain health specialist, but a psychologist also. So what are the social factors, environmental factors for people who are susceptible to drug addiction or the substance abuse? And also a second part of this question would be the rehabilitation part. What is alcohol or drug rehabilitation, and how we can achieve in our countries like India, who are lower and middle income countries?
Yes, thanks. And again, thanks for having me. I should have also brought our colleagues. We have a separate unit dedicated to substance use within the Department of Mental Health. And these are colleagues who really are the experts for treating alcohol and substance use disorders, as well as addictive behaviors that we've heard about earlier. I should also say that we're currently in the process of re-evaluating all our clinical guidelines for treating substance use disorders, alcohol use disorders, and gaming or addictive behavior. So there will be more guidance coming out later this year or early next year. So for now, I can really only give you like an overall response to or how the Brain Health Position Paper addresses or sees this. So like we've heard earlier, it's important to look at this holistically. We cannot, or we do need to move beyond the silos, and this is why it's also very exciting for me to see that we're bringing substance use experts together with mental health experts and neurologists to really see like it's all interconnected, and so are the determinants of brain health. It is absolutely important to increase safety and security, as well as the social connection and stable relationships with parents, with the caregivers early in life, which can buffer some of the stresses and adversities that we all will face throughout our lives. But what really determines whether or not someone then develops a substance use disorder or any other kind of like maladaptive coping behavior really depends on whether or not we have access to supportive caregivers, parents that we trust, strong relationships with our peers. And this is where adolescent, like early life, is a very crucial developmental period, and then adolescence is equally important. And this is, for example, one of the things that we watched very with great concern during the COVID-19 pandemic, and like seeing when adolescents, for example, did not have the same extent or the same opportunities to meet and be with their peers, to form those really fundamental and important relationships with their friends. So this then creates the importance of just being mindful of supporting children and adolescents throughout these important neurodevelopmentally critical phases in their life. Yeah, I think I'll leave it and wait for the next question. Thank you.
Thank you. Dr. Sumantra Das is asking a question to you, Dr. Catherine. So he wants to know, how does WHO advise to treat behavioral addiction? Is any guidelines from the WHO in the pipeline? I know there is a roadmap which you elucidated, and the document which we are waiting for August 9 would be addressing some of these issues. So where does the WHO stand for treating the behavioral addiction guidelines and to the member states of any policy making?
They are in like an earlier version already included in what is called MHGAP, so our Mental Health Gap Action Program, which is the overall flagship program for treating mental health, neurological, and substance use disorders. In there, we have some like tracer conditions that are relevant, and that's one of them. And those guidelines we're currently updating. So the last update had been done in 2018 or 2019, and we're now doing a full review. So by later this, more likely early next year, these will be available.
Thank you. So, Dr. Prabhat, I have a question for you. Why do some people react differently to the alcohol and other drugs? Some people develop tolerance and some people develop quite early addiction. So what are these predictors and determinants which help us to find out the people behaving differently to the alcohol particularly?
So before I just go, sir, a couple of just add on. I think Sudhir mentioned about drug addiction, but now obviously non-drug addiction has come up in the new classification system. I think Catherine did mention. So pathological gambling and internet gaming disorder is still in the borderline. It's not come to the in between in DSM-5. So you're going to see another spectrum which are gambling and internet gaming as a diagnosable substance, non-drug addiction. I think just to add Sir's point.
I'm going to address this in next question, but anyway, it's good.
Sorry. So I think coming to the question, sir, you are asking me why some people recover early or why some take long time. This is the question, sir.
Why different people react differently to the alcohol use. Some people will develop addiction, the others will not develop addiction.
Okay, understood. So I think, just before I go further, let me give one line. What is actually simple definition of addiction? So, all up and it fits to brain, World Brain Day. So addiction is a chronic brain disease. First point. It involves a complex interaction between brain circuit, genetics, environment, and individual's life experience. So it's a complex condition, brain condition, a treatable condition, and all factors are involved. Now, because many factors are involved, it depends on which factor is prominent. Let's see an example. If I seeing somebody, or we all of us seeing some person who's both father side, for the parents has substantial genetic burden of, let's see, alcohol addiction, and the both side, father side and mother side, you have plenty of addiction. The vulnerability is much higher. That this person, even he want to do a social drink, the likelihood of his getting to addiction is much higher than the people who doesn't have their genetic risk. So this person is more vulnerable. Now, second, if the person having a very bad individual life experience, broken family, poverty, poor scholastic performance, lot of deprivation, stressful events, certain socioeconomic status, poor status, I think Dr. Sudhir mentioned about inhalant use and stuff like that, they are more vulnerable. So again, it comes to individual life experience, trauma at the beginning of the, in the early part of career. So environment, accessibility. Now you have everything easily accessible, threshold of, things much lesser, poor parenting. So this all the factor actually decides when the person gets into the substance and develop addiction. Last point is temperament or personality. I think I heard the externalizing symptoms, like somebody is very impulsive, hyperactive, poor concentration span. And morning actually I saw somebody exactly same. He's a B engineer, very good professor, very good engineer, but he cannot sit one for some time. In my OPD, I was seeing him so restless when I was seeing me. Very restless. And when I ask wife tells that he just get bored so easily. So those type of temperament, hyperactivity, you call it, or sometimes they call adult ADHD, they are also very vulnerable. So all these factors actually plays a role, sir, to decide who gets addicted and who gets protected. Thank you.
And what about the peer pressure?
Yeah. Yes.
In teenagers, it can lead to stressful and increased likelihood of experimenting what the other peers are doing, and which can lead teens to try substances and experience other mental health issues.
Just to add, we call it novelty seeking. How you are seeing more. So there are many kids, and we all know about many adolescent people, but some people will love novelty, bungee jumping, high risk behavior, driving bike in much faster rate. Those are called novelty seeking. Multiple relationship, not stable, and as you mentioned, sir, they are more vulnerable to experiment. They take alcohol sometime, then take cannabis, opioid, just go on experimenting with peers. So that's a trait that actually very high risk. Thank you, sir.
Dr. Amit, just to continue the discussion on the alcohol addiction. So what are these withdrawal signs or signs of withdrawal symptoms, and how long do they last, and how to manage these alcohol withdrawal symptoms?
Yes, there are a host of physical symptoms for alcohol withdrawal. Like that's characterized by alcohol seeking behavior, sweating, there are changes in day behavior and sleeplessness, and the patient, that is the time which is the patient needs detoxification, and when the person is brought to the hospital, is treated with the patient is treated with long-acting benzodiazepines and other medications like naltrexone, and after controlling the phase of withdrawal, then the person can be put into maintenance treatment. Maintenance treatment is advised for to reduce the craving for alcohol. There are a number of medications which are used for maintenance treatment. Baclofen has been used, although it is an off-label use. There are other the medications which have been used for maintenance, for example, acamprosate. And recently there is much interest regarding use of cannabinoids for treatment of alcohol craving, because craving is the central symptom, central theme for which the person relapses. And for all substance use behaviors, craving is the central theme for which a person relapses and gets back into the drug seeking behavior. That's why it is substance use, alcohol, and other drugs and other drug use disorders are chronic relapsing disorders. So there are two main components of management of alcohol use disorders. First is the treatment of withdrawal in the emergency phase and putting the patient on maintenance treatment with appropriate treatment, appropriate pharmacotherapy, as well as behavioral therapy. There are several components of behavioral therapy, and which is handled by the psychologist. But taken together, the behavioral therapy as well as pharmacotherapy is the effective modality of maintenance treatment for not only for alcohol use disorders, for other substance use disorders also.
Thank you, Dr. Amit. Dr. Sudhir, I just want to know from you, with your vast experience on treating these patients, many people are once motivated and then they stop taking alcohol or drugs, and after a while they get a relapse. So continuing the having abstinence or continuing treatment is a problem, a social problem. So how do you see this kind of a behavior or this kind of a issue when you subject the people for de-addiction programs? And some people would enroll into it, and after a while, they will get back to the alcohol once they get opportunity to use it.
Yeah, I think that's a very common problem. Now we see two types of people with drug dependence. One is those who come on their own. The doctor, I'm addicted to alcohol, I want to leave it. And the second class is the patients who are brought by the family, the parents or the spouse who want the patient to stop taking the drug. Now, in the second variety, the outcome often is not very good because the person has not come with his or her own motivation. But in the first instance, the outcome is generally better. Now, a very important factor in who will stop taking the drug and who will not, it's one of the factors as to how often does the person seek treatment, what is the frequency of the contact with the therapist, whether it's a psychologist or a psychiatrist or whosoever, because it has been shown the more frequently, for example, the more frequently the alcohol dependent person meets his doctor, the more is the likelihood of a stopping alcohol. So I think a continued follow-up with a relatively high frequency, I think that's extremely important. And when I teach postgraduate students, I often tell them that there are three important things when you're doing counseling with a client. First is empathy, second is empathy, and the third is empathy. I mean, it's very, very important for us to empathize with the client because, I mean, we know that in all drugs of dependence, there are ups and downs. It seldom happens that the person comes to the treatment agency and stops the drug forever. But there are ups and downs, there are slips or relapses. And so I think throughout this journey of the dependent person, I think an empathetic therapist who tries to see as to where the impasse is occurring, who empathizes with the plight of the person, who can suggest solutions to whatever is leading to the relapse. I think that's very important. So I think as my previous speaker said, Dr. Chakravarti, I think it's important that both psychological treatments and pharmacotherapy. Pharmacotherapy also helps. We have medications which are anti-craving medicines. For example, with alcohol dependence, there are at least 4 or 5 anti-craving drugs available in the market. So a good contact with a therapist, a family that is supportive to the patient and not kind of imposing or pushing the patient, and proper use, judicious use of pharmacotherapy. I think these are certain things that improve the therapist-client contact and the long-term outcome.
Thank you, Dr. Sudhir. Now I want to bring Dr. Catherine into the discussion and ask about different, being an international organization such as WHO, which governs and have influenced so much on the member states. As you know, the 2/3 of the population lives in lower and middle income countries in South Asia, Pacific, and the Africa continent. So, do you find a different approach from the governments in legalizing and in treating and in making it a social issue or a medical issue? Why the addiction is treating a mental health setting rather than being a social issue, which we are all as stakeholders also are responsible for that. Where does WHO and such organizations come into picture to handle this booming crisis in coming years?
Thank you. And again, as a caveat, I'm really not the WHO focal point or expert to talk about this topic, but my colleagues do, and there are ongoing high-level communication conversations with member states to develop strategies for alcohol, but also for other substance use. It was, for example, also discussed at the just past World Health Assembly. So I do think there is growing awareness for the topic, and it is taken seriously. But it is a big topic and not an easy one to address by no means. So we will probably be talking about this for the years to come with multiple issues. For example, I'm now also thinking in dealing with industry when it comes to substance use and addictive behaviors. So there is a lot of, I believe, unsolved issues and ongoing debate in that area. But the team and our colleagues in the substance use unit are very much engaged and working closely with member states. And particularly because your question was on low and middle income countries, focusing on policy options or ensuring that we're not leaving the most vulnerable or the most disadvantaged behind, but actually are implementing policies that are helpful and applicable to this content. So I will put in the chat also the link to the substance use and addictive behavior program, where you can read all the work that our colleagues are doing, and also receive updates on any policy actions that are happening and technical products that they have developed in the past.
Thank you, Dr. Prabhat. I just want to bring it. Being a social issue, as Dr. Catherine is also a psychologist and a great proponent of behavioral medicine, can it be just a social issue because it's a large, bigger source of revenue for the governments, and alcohol and smoking are two main source of revenue generation in the governments? How can association like Indian Academy of Neurology or Indian Psychiatry Society play a bigger role in handling these not only geopolitical, social, and the other regions, but also as a professional responsibility for us to take this matter and talk as an advocate to the concerned stakeholders and policymakers at the governmental level?
Thank you, sir. I think the whole point is that addiction is not a disease of a person; it's a disease of family. So you must have seen people who get addicted. The family member is much more worried than the person's family is affected much earlier than the person itself. And as Sir mentioned, or Sudhir mentioned, that so often family will come and ask. So now the challenge here is that, and also to make that unfortunately, in our, since our medical curriculum, we never had a specific, substance use, or let's say alcohol or tobacco at all. So what we started doing at NIMANS, that's why the Digital Academy I put there. So we started improving the capacity of the physicians, hepatologists, who are likely to receive more. I remember last year we have a transplant hepatologist across the world, because many countries, the transplant hepatologists are the people, those hepatologists are supposed to transplant, and the alcohol is a major cause. So how to train them very briefly with a case discussion? How can they identify? They can prescribe. They can do the brief counseling. We do a regular program for physicians. Many physicians, many specialists in other branches also join, because I think the best, at least at NIMANS, and I'm pretty sure other neurological centers, many of the seizures, withdrawal seizures, will come to neurologist. You all know it. Delirium tremens comes to neurologist. So ultimately, you are the neurologist actually is very well placed, and you are less stigmatizing than us. See, coming to a psychiatrist is obviously comes with a huge amount of stigma. All of us know it. So when you tell somebody come with seizure, I've seen many people seizure, and neurologist tell, look, you stop alcohol, otherwise it's going to be withdrawal seizure. All of us know once you develop withdrawal seizure, recurrence rate is so high, and that's very powerful. What we need to do little more is to probably offer little more help, pharmacological or brief counseling. I think that's the bottom line. We have to have a lot of people providing the services, and at least prevent the development addiction. Let have social drinking, well and fine. Who are vulnerable, no. But can we prevent the end organ damage? And I think I'm pretty sure. At least NIMANS, you see a monthly twice on Korsakoff, complete Korsakoff, and they can do anything. I know. So those type of serious condition can be prevented. Training physicians, specialists, and empowering them and democratizing the knowledge is the way forward for this problem of this magnitude. I don't think psychiatrists cannot handle. It's impossible to do it, sir. Thank you.
You very rightly said that being a little bit of stigmatization, we also tend, NIMANS, like IBHAS, is a neuropsychiatric institute where we have two verticals, neurology and psychiatry, and many patients tend to be admitted in neurology because they don't want to get into psychiatric ward. So obviously we have that advantage, and we offer that to many of our patients also. But having said that, Dr. Sudhir, I just wanted to know, since Dr. Prabhat was talking about the recent advances and medications and other things to cure this menace. So what are the recent advances in psychedelic drugs in this in the treatment of addiction or drug abuse?
There is much talk about the psychedelic drugs lately. Till a few years earlier, it was a complete no-no. The psychedelic drugs are illegal; they are not to be taken. But lately, all over the world, a good amount of research is going on into psychedelics. Now, for the sake of the public, I would like to just briefly tell that psychedelics are drugs, medicines, or rather drugs, which lead to hallucinations. The person hallucinates, hears voices, or has visions, has altered consciousness, and so on. And there's a lot of research into these, and it is claimed that these psychedelics, some examples are LSD, psilocybin, which is also commonly known as magic mushroom, or mescaline, ketamine. They are being used experimentally, again, in the management of certain conditions. They have been shown to be useful in problems like depression, anxiety, post-traumatic stress disorder, paradoxically, addiction itself, eating disorders, and a few more problems. Now, having said that, I must state that use of psychedelics has not come in the mainstream psychiatric treatment armamentarium. It continues to be experimental, being conducted in academic institutions largely. One of the reasons for that is that psychedelics do have their own problems. They can give rise to difficulties like fearful reactions, sometimes triggering psychosis, and sometimes even physical harm in the form of certain kinds of cardiovascular diseases. So research is going on, but we still need much research before we can really standardize a given psychedelic in a given dose for a given condition. But yeah, there is work going on. And we think that perhaps these could be the drugs for the future, at least if used judiciously.
Thank you. Thank you, Dr. Amit. Now, just we want to tell the audience about the long-term harmful effects of alcohol and smoking. These two commonly, used addiction substances. So, in terms of physical adverse effect of chronic use, we want to tell the people that it causes effect on almost every organ, whether it is liver or it is brain or it is heart or it is pancreas or everything. So would you like to mention some of these long-term effects which can be actually life-threatening to the patients who consume alcohol or smoke or have these illicit use of substances?
Yes, uh, alcohol and substance use is such an area that I have heard people saying that actually, these are very interesting thoughts actually. I was talking to a senior physician, say, a couple of weeks back. So we were discussing that what ICMR is currently doing. So we thought we were discussing that ICMR is now conducting a study on how COVID-19 is affecting mental health. So I was sort of amused, being a senior clinician, said, so why mental health? Mental health does not cause any death. Why don't you do it on cardiovascular disorders? Because COVID-19 causes serious cardiovascular complications. You should research on cardiovascular complications of COVID-19, not mental health. Mental health does not cause death. So this is sort of abuse, and this is sort of the public perception that mental health does not cause death. So we do not look at overdose. During COVID-19, there was sort of there was a crisis of overdose, people dying from overdose. People who are on opioid maintenance treatment, they did not get their access to maintenance treatment because of the COVID crisis. There was a rapid surge in overdose. It was manifested not only in India and globally. I know in various drug dependence clinics in India, they had to remodel their substitution treatment to provide maintenance treatment to opioid users. We tend to forget road traffic accidents, which is caused due to from alcohol use disorder, because these deaths do not come into account, and we think that these are isolated. These are not related to substance use. We do not take into account deaths from suicide. Suicide is a major public health problem, not only in India, but also globally. We do not take into account that a significant burden of suicide comes from substance use disorders and associated mental health problems. So apart from the standard chronic ill health that comes of alcohol use disorders, we all know that gastrointestinal disorders, including liver disorders and neurological disorders, cardiac disorders, we all know. We all know the health issues that occur out of smoking, but we do not want to think about other serious health issues which can have significant mortality from alcohol use disorders as well as other substance use disorders. A, overdose. B, suicide. 3, road traffic accidents. If we take these public health issues, and each in its own capacity is a public health problem. Road traffic accident is a public health problem. Suicide is a public health problem. Overdose is a public health problem. So that magnifies that multiplies the problem of chronic ill health from alcohol and other substance use disorders.
Thank you. Dr. Catherine, I was watching your presentation very closely, and you did mention about the cognitive fitness in addition to the physical fitness. And many of the addictions, in particularly alcohol, since we are talking much about these addictions today, can cause cognitive decline and dementia, which is your domain in WHO. So what would be your advice for such people who want to increase gauge their cognitive fitness in addition to the physical fitness, and or also substance abuse disorder afflicting?
In the area of cognitive stimulation or cognitive therapy, there are formalized interventions that have been shown to reduce your risk of developing dementia. But these are formal programs. What I usually recommend people do is, people used to say do crossword puzzles. This might be challenging for some people, but not for others who do it every day. I think for cognitive stimulation to work really well, or get your brain to work and train, similarly to like getting a sweat when you do physical exercise, the activities need to be a bit tricky for you. So if you do Sudoku or crossword puzzles every day and you just do it in your sleep almost, this is not going to work or do the trick. You need to challenge your brain, do something a bit more tricky. Playing chess, learning a new language is always a good thing. Things that combine physical exercise as well as mental exercise are things like ballroom dancing or learning new steps, following different routines. All that will challenge your brain to do things slightly differently to what we normally do. Our brain is really smart in the sense that we tend to problem solve always in the same way. Like we have a certain system that we've learned over the years that works. So if we're doing it the same way every day, we're using the same pathways, we're not necessarily creating new networks or new connections. So I encourage everyone to do something, learn something new, be the language, be a new dance. Everything that you're not used to will create new experiences and new synapses in your brain.
Catherine, now we have almost 5 minutes left in the discussion, and I want to take it to Dr. Prabhat with different kind of theories in terms of addiction medicine, whether red wine is it's okay to have red wine, or it's okay to have the other small amount of illicit, not illicit, but whatever you call it them. They can be used for stimulating your time or attention span, or used in exams or things like that. So what is your take for our public, for our people who are watching this program or listening to this discussion? People have different kind of opinions and perceptions, whether or not backed by the evidence-based medicine, but still every now and then you hear new issues coming up, being about the different things in the addiction medicine.
Yes, sir. I think thank you, sir. I think the problem lies with us also. All of us, the old saying that if you go to general physician, you have take little bit of, thoda sa le lo, matlab, take little bit of alcohol, nothing will happen. You all know that this old saying, and it still happens. It's a little bit of alcohol is no problem. No, so the advice to the people who are watching, they're not from professional first. If you've not started any substances till now, do not start. If you're not started, do not start, including tobacco, alcohol, whatever you are talking about. Second, if you have been using, let's see, alcohol, look, are you crossing certain limit? Now, unfortunately, at this point of time in India, we don't have any limit, unlike US and UK, which has a healthy limit drinking, but at least at this point of time, we have not come to that sort of thing. Now, regarding the red wine, there is a study in India also that the curve of JSF doesn't exist in Indian population I'm talking about. It actually does not help. It definitely helps in Mediterranean countries, all of us know it, but the large-scale study among the cardiologists published a few years back, huge study, they didn't find that sort of advantage in our population. That's a challenging scenario. So alcohol having advantage, less amount of alcohol or social drinking having advantage to cardiac health has not been proven, at least in Indian population at this point of time. Third point, now also we have seen in Indian population, as I think, sir, you mentioned yourself, out of 16 crore users, 50% are using unhealthy or problem drinking. That means many of the population of India are drinking to be drunk because it's not it is socialized, it is a taboo in sense, in the country in India. So out of 16 crore population, if 8 crore 50% are problem, then you have a huge problem if you have a controlled drinking or advised drinking and it's not proven. So this is second advice. Third, use the upstream model. Don't look at downstream. Upstream models like how to prevent adolescents exposed to substances, using a safe space for them, using more healthy green areas they can play, they can talk about, increasing their resilience. So you have to increase the upstream rather than looking at the end stage liver disease, like me looking at all addiction end stage, which is not going to help a lot. So I think improving the protective factor, improving the resilience, I think many of the speakers did mention about that. I will help. These are three things I can tell, sir. Thank you, sir.
Thank you.
Dr.
Last,
Doctor,
yeah, last
I just wanted to comment.
Yeah.
What about the conflict of interest of the policymakers regarding tobacco, smoking, and alcohol production?
So I didn't want to touch about this very sensitive issue of
It's a very sensitive issue.
I think that revenue generation, particularly in our setup, comes from alcohol and smoking. Although there are other now gutkhas and other chewing tobaccos and other things coming up, which are a great source of revenue to the government. But all these things at the level of policymaker, the government is taking up. Of course, in last 10 years, we have seen very much awareness about the warning signs, and the people are raising voices now. That's, I think, awakening in our society. And as a society, we need to take up this issue and sensitize the people. And one of the aims of this webinar is to create awareness and sensitize so that we become a force to reckon, and the governments and the policymakers listen to us rather than having their priorities on the revenue generation. So last minute, I want to give it to Dr. Sudhir Bhave, because driving is such an issue which is so important in our young population, in a young nation, where we have, as the Prime Minister says, we have a young nation and with a young population. So driving and alcohol, and in particular reference to the breath analyzers and the blood alcohol concentrations, which we talk enough, but has it really made a difference, or we need to do more?
Well, I think if at all there is some difference, I would not say it is significant. I mean, there are rules in place, but then there are ways to circumvent it. Like I have personally come across youngsters who go for a party, but then along with them, they take someone who drive the vehicle, so that if the police comes to catch, then the breathalyzer would not pick up anything. So I mean, fine. I mean, on paper, these rules look good. Specific percentage of alcohol, nothing being permissible beyond that. I mean, posting police people on 31st December or other Indian festivals when drinking is more common. But frankly speaking, I think on barring those given days and those particular areas where there is closer monitoring by the authorities, I think on the whole, it doesn't seem to be working. I think it's more of a creation of awareness in schools, in institutions, and other places about the harmful uses, harms arising out of these drugs that might help more than these kind of patchy, half-hearted interventions at the policing level.
Thank you, and thank you all the speakers and panelists, and all. We have almost crossed the time limit by 1 minute. And on behalf of the Indian Academy of Neurology and all of us, we are grateful to all of you, as well as for the listeners who have been with us for last 1.5 hours. Once again, I'm grateful to the Dr. Chandrasekhar and Dr. Nirmal Surya for giving this opportunity to me to moderate and have this session, which is very crucial in our country, particularly with the young people. Thank you once again. And Dr. Chandrasekhar, would you like to wind up and
thank you.
The closing remarks?
Would Catherine like to make a last 1 minute comment? Catherine?
No, I think it has been absolutely fascinating to watch the conversation. I congratulate all of you for the contribution and having that conversation. Like I said earlier, I think we need more of these discourses between the different disciplines to tackle something that is so big and all-encompassing. So thank you once again for having me here and supporting WHO in the implementation of the action plan. We will need all of you to make this happen. So thank you very much and happy World Brain Day.
Thank you. Thank you. Thank you, Catherine. Dr. Nirmal Surya. Nirmal, would like to make some comments?
Yeah.
Yeah.
So thank you very much, all the speaker. It was wonderful to listen to all of you, and really very crystal clear about the various addiction and also about the what are the way forward. And I like the idea of Dr. Prabhat of training and educating your colleagues and other physicians. I think that's what model we have been also working on diseases like epilepsy. We're training the physicians and other, because to reach out to the large society, we really need a manpower. And I really appreciate that you brought it forward. Thank you, everybody. And Dr. Mesha, we need to create an awareness for these sensitive diseases where people just get addicted. And we should work as a team. We should not divide that this patient should go to the psychiatrist or physician or liver specialist. Let's work as a team. Anybody comes, let's handle them as a team leader. And that would be the way forward for the future. Thank you, Dr. Dhamija, for a very, very interesting discussion and bringing out the points from all the panelists. Thank you very much.
Yeah, thank you, Dr. Nirmal. Tomorrow, same time, 6:30 p.m., we have two very interesting topics. Loss of vision, which will be moderated by Dr. Vivek Lal, who is director of PGI Chandigarh, and vertigo, which will be moderated by Sudhir Kothari, who is a neurologist at Pune Hospital, and he's head of the neurology there. So watch out for an interesting session, 6:30 p.m. Tomorrow. And I would like to thank all the panelists and guests, and especially Dr. Catherine, to taking out so much time on a very busy schedule and being with us and staying for the whole session. Thank you very much. And we look forward to working with you and the WHO in future. I am also heading the tropical neurology subsection of World Federation of Neurology. And we'd also like to have collaboration with the WHO in that area, because that area also needs a lot of attention and intervention from WHO. And I would like to thank Dr. Rajinder Kumar Dhamija for excellent moderating the session in a masterly way, and my friend Dr. Sudhir Bhave, Dr. Prabhat for getting in at the last moment. Dr. Pratima Murthy has not been doing very well, and Dr. Amit Chakravarti. So thank you very much, everyone, and thank you all the audience for participating in large numbers. And this recording will be available on YouTube and of the site of Indian Academy of Neurology, so you can watch. Those who could not attend today's session, they can watch later on. And we look forward to another exciting session tomorrow. The first 2 days have been just wonderful. Thank you very much, and good night.
Thank you.
Thank you.
Good night,
Thank you,
everybody.
Thanks all.
Bye-bye.
Good night.
Bye-bye.
Bye-bye.
Thank you, Mansi, and